Hello and welcome to the Carteret Community College Respiratory Therapy Information Session. This session should give you some basic overview about our program here at Carteret Community College, some of the requirements, some of the academic information, an overview of admission requirements, and some of the courses that you need to complete as part of our program. Of course, we're an educational facility, and our educational program teaches our students how to take care of respiratory and cardiac issues with our patients. And we do a lot of education, and our students educate our patients. You see some folks here that are some of our recent students, and the two gentlemen that you see we're actually doing a presentation at one of the local high schools. This was our fall cohort for 2025. Lots of smiling faces. And our program is accredited by the Commission on Accreditation for Respiratory Care. Our program number is shown here, 200278. And you can see our accreditation information at the website provided. Cohort and the NVRC and the American Association for Respiratory Care are promoting the field in a special ad campaign currently called More RTs, as you see the link here. I encourage you to go to any of the websites of the organizations I just mentioned and find information, or go to morerts.com. Our mission is to prepare our students to and provide high quality education, psychomotor skills, and help you develop ethical principles to provide the workforce with competent professionals in our field. I mentioned the admission requirements. Those are listed on our program page that you will find on the carteret.edu website. These are some of our admission requirements. You must be a high school grad or equivalent with transcripts from your high school GED. And if you have attended any higher education classes at other colleges or here, the admissions office will ask you for those transcripts. Your high school GPA must be greater than 2.8. Somewhere you must have completed a chemistry or physics that included a lab. And you will see, again, all this information on our program page on the website. This is what the landing page looks like. You'll see a program overview, information about our degrees and pathways, and then a button to request information from our admissions office. We want our interested students to recognize this is a difficult program. We are taking care of real people, and we start taking care of real people first semester, so it's fairly rigorous. We want our students to expect to be prepared to study, to ask questions, to be curious, dig for the why, and ask questions if you don't understand something. The respiratory classes require a passing grade of 80% or better to continue in the program. And we feel like if you are here in class and at clinic, you're more apt to learn. So we do have a minimum attendance policy. We ask that you attend at least 90% of your respiratory program classes and clinic. You'll see our courses listed on the program page. Again, first semester, Anatomy and Physiology 1, a writing class, English 111 if you've not had that already, and then you'll see 4 respiratory classes, including Introduction to Respiratory Care, Anatomy and Physiology of the Cardiopulmonary System, and Respiratory Care Pharmacology. And lastly, there is Clinical Practice 1. And again, note our students start attending clinic about midway through first semester. Spring semester, Anatomy and Physiology 2, which is Bio 169. If you've not finished that or completed that, you'll need to do it in spring semester. RCP 111 is Therapeutics and Diagnostics. That's a really heavy course, a lot of information in there, a lot of diagnostic tests, including ECGs, how to perform incentive spirometry, blood gases, IPPB, airway management, including suctioning, intubation, and extubation, as well as pathophysiology of the cardiopulmonary system. There's a lot of hands-on practice in those classes. So you see a couple of special practice lab listed here to give you additional practice in the lab. Learning hands-on skills, how to perform tests, how to perform diagnostics. And then third semester is summer. That is patient management. That course is on Mondays and Tuesdays. And then your Clinical Practice 3 is Wednesdays and Thursdays are the primary days for clinic in the summer. We do overlap with a couple of other respiratory therapy programs. So we're currently doing 2 weekends in the summer at ECU Health in Greenville. So again, your primary clinic day currently in the summer is Wednesdays, Thursdays, but there are 2 weekends in there. And you'll know well in advance so you can schedule around that as you need to. Fall semester, the 4th semester of the program. If you've not taken psychology, you need to complete either Psych 150 or Psych 118, as well as English 112 or English 114. And then you'll see critical care concepts. This is additional information evaluating patients in critical care, intensive care, continuing ongoing ventilator patient management, and then neonatal and pediatric respiratory care. This is our small population, so this is the newborn population, the preemie babies and that kind of thing. And that's currently taught by a specialist out of Greenville that comes down once a week and teaches that class. Some of it in person, it's a blended class, some of it in person, some of it online. And then your clinic in that 4th semester continues and is Thursdays and Fridays. And then spring, your 5th semester, Advanced Monitoring and Procedures, is a class that continues hemodynamics, a lot of invasive diagnostic procedures, and some advanced forms of mechanical ventilation. And then career prep helps our students transition from the role of a student to that of a practicing respiratory therapist. So we do some career prep, such as preparing you for your national board exams. And then clinic continues in spring semester. It is Thursdays and Fridays. Our program requires 3 hours of the humanities or fine arts. If you already have one of those, you can substitute that in. But here are 3 that we recommend if you need your humanities elective: critical thinking, or cultural studies, or introduction to ethics. Now, that is your 5th and final semester to complete your associate degree. You will have everything that you need to pass your boards, pass at the high cut score, and work as a practicing respiratory therapist and licensed in any of the 49 states that require license. If you want to continue your education, there are several opportunities to do so. UNCW offers a BSRT, so a bachelor's degree in respiratory therapy, as does UNC Charlotte. And UNC Charlotte is also in the process of developing and introducing an advanced practice respiratory therapy program. Appalachian State also will accept our students as juniors, and I think their program is in health sciences. Recognize that, yes, we have classroom activity, we have lab activity, but I mentioned already clinic activity. Our students work at a variety of clinic locations as part of their clinical education. We send students to Carteret Healthcare here in Morehead City, Onslow Memorial in Jacksonville, Carolina East in New Bern, and as far north as ECU Health in Greenville, as far west as UNC Lenoir in Kinston, and as far south as two hospitals in Wilmington, Novant, New Hanover Regional Medical Center, as well as their orthopedic facility. So based on where you live and your clinic days, some students choose to drive early mornings. Some students decide to go up and stay the night before, maybe get a motel room between clinic days. That's your prerogative to make that decision. I mentioned clinic. Our first semester clinic days are 1 day a week, and they are Tuesdays, as you see listed here. The first 4 or 5 days, 4 or 5 Tuesdays are going to be on site here on campus, where we develop your information, your knowledge about patient safety, your safety, patient assessment, basic oxygen interventions, and that kind of thing. Second semester, your clinic days are Mondays and Tuesdays, mostly 8-hour days currently, and they are in Wilmington, New Bern, Morehead City, Onslow, and Kinston currently. And there's a specialty rotation in the pulmonary function lab, which is associated with Carolina East Medical Center. Third semester, we add ECU Health in Greenville. We add Novant, New Hanover in Wilmington, and continue to go to Carteret Healthcare and Carolina East. Fourth semester, we continue your rotations at those facilities. We add a specialty rotation, R.H. Howell facility in New Bern, so there's a couple of days there. And we hope to get a rotation in a pulmonologist office in New Bern. And then fifth and final semester, again, your clinic days are Thursdays and Fridays. You'll continue it at Carolina East, Carteret Healthcare. You will continue at ECU Health in Greenville, as well as ECU Health in Greenville and Novant Health in Wilmington. Of course, you recognize you do need to pay tuition. When you're in school, you have books. Most students expect that. There are some additional fees here. I won't read all of this to you, but just hit some of the highlights. Our clinical sites do require that everyone attending clinic submits and passes a drug screen and a background check. That is required by the hospitals. The results go directly to the clinical sites. Excuse me. And they in turn will clear or not clear prospective students for clinic. Clinical onboarding here, the $65 is software associated with the onboarding process. And then our students are members of the American Association for Respiratory Care. That's $25 a year. That's a very valuable membership. It's about $100 for a therapist. You get a nice student discount, and that gives you access to journal articles as well as a discount when you take your board exams currently. Our clinical sites also require that you complete a medical exam and have the required immunizations in order to attend their clinic rotations. Our clinical coordinator, Ms. Kim Miller, will help facilitate that as fall gets a little closer. And then our students wear scrubs that are currently available in the bookstore. They are royal blue and they are already embroidered with the respiratory therapy logo. And you notice it says shoes here also. We are a practice that are on our feet a lot. So you need a pair of very comfortable shoes that are predominantly all black or all white, because we are on our feet a lot. You need to complete American Heart Association Basic Life Support for healthcare providers. That certification currently is about $68. It includes the book. That course is available on Saturdays here at Carteret Community College, and you can find that information on the website. Craven Community College offers it, as does Coastal, and you can get it at several different facilities. Travel expenses, of course, that's going to vary based on your what you drive, how far you have to go, and that kind of thing. Several of our courses have lab fees associated with them. The lab fee helps us purchase consumable items so that you can apply nasal cannulas, apply mask, use syringes to draw blood, and so some consumable items there. So you see some lab fees in first year and some lab fees in second year. And then assuming that you want to walk across stage, your graduation regalia is about $38, and we have a pinning ceremony each year. Cost of that pin varies a little bit, somewhere around $50. And then when you graduate, if you are applying for a license in North Carolina, there is a application fee, background check again for them. If you want to work as a respiratory care assistant, some of our students go ahead and apply for that very specific limited license at the beginning of their third semester, and allows them to begin working as a respiratory care assistant in the field. Not required, but it gives you an opportunity to develop and learn and hone your skills. We are a profession that deals with communicable diseases. So I already mentioned lab safety, your safety, immunizations. We want our students to be able to protect themselves, protect their patients, and hopefully not get sick. So we'll talk about where to wear a mask, when to wear a mask, what type of mask, isolation equipment that you need, when you need it, and that kind of thing. But understand, we are dealing with communicable diseases, and sometimes we are exposed to those, although we try to limit that exposure. So I already mentioned the physical form and the criminal background check and the drug screen. We ask that our prospective students participate in a hospital shadow. That form is available from me. If you will email and ask for that form, I'm glad to provide that for you if you've not completed your shadow yet. And that currently is set up so that you can complete your shadow either at Carteret Healthcare in Morehead City or Carolina East in New Bern, North Carolina. I mentioned your uniform. You will need one uniform first semester, about week 4 or 5, and those are currently available in the bookstore. Second semester, clinic is 2 days a week, so you'll probably want to pick up at least a second set of scrubs, again available from the bookstore. Instructions for your physical, the physical form itself, instructions and timing for your drug screen and background check, all will be shared probably sometime in mid to late June by Ms. Kim Miller, our clinical coordinator. We offer a variety of student services here at Carteret Community College. We have an advising center where you can get special tutoring and a quiet area for testing. We have a nice library that overlooks the Intercoastal Waterway with research databases, ebooks, videos, and a variety of specialty journals, as well as some fiction if you just need a break from studying sometimes. We have distance learning, and I mentioned that some of our courses are blended. So some of that activity, some of the teaching is going to be in the classroom, some in the lab, some at clinic, and some of it online. And then, of course, we have an excellent IT department that can help if you have computer issues, computer access, passwords, or just need some basic help with technology. We also have disability services available. If you feel like you need special accommodations for testing or some other function to help you be the best student that you can be, we can direct you to our disabilities coordinator to follow up with that availability. And financial aid is available for most students. Even if you feel like you do not qualify for financial aid, we highly recommend that you fill out the FAFSA form and submit that. Sometimes that may make you eligible for some grants or scholarships that would be helpful to offset some of the expense of going to school. So where do our students work? Where do our graduates work? Variety of hospitals. Of course, statistically, most of them are going to wind up working in a hospital someplace, and that could be a medical floor, surgical floor, intensive care, both adult, cardiac, children, or neonatal. As therapists, we work in the emergency departments, pulmonary rehab, and sleep labs. We have therapists that work in physician offices. Those typically perform patient education and maybe pulmonary function test. We have therapists that work air and ground transport, so moving patients from one facility to the other. So you see there's a variety of employment opportunities available. One of the things that we do each fall is invite our students to attend and participate in the annual North Carolina Society for Respiratory Care Symposium. It's a 2 or 3 day conference for some continuing education and networking, meeting other providers, meeting students from other colleges, and part of this also we typically have a sputum bowl competition. These 3 young people were our sputum bowl team this past year when we met in Wilmington, North Carolina, and if I remember correctly, they placed 3rd in the state. So they actually did pretty well. This is some of our students that graduated last year. It was always a pleasant experience, a big day when graduation comes, kind of wrapping things up as they transition from a student to a therapist. I'm really happy to say that we have had a very high, very good success with our students. We have had a high pass rate. We've had a 100% pass rate on our boards for the past 5 or 6 years, I think. All of our students that are looking for jobs have jobs, so that's not an issue. And as a matter of fact, last year and again with our current students, they have all already committed to work someplace. So again, employment is not an issue. I mentioned our program page. There you will find a lot of the information that I've shared with you today, including my contact information, my office phone number that you see, the 6171, and my email address. The QR code that you see on the screen will take you to that program page that I referenced. If you have questions or need additional information, please reach out either with the phone number that you see there or email. I'm glad to talk with you and look forward to hearing from you. Thank you and have a great day.